As with hip pain, maybe 1 in 5 of us will suffer with knee pain at some point in our lives, right from early years through to later adulthood, when we may need to think about some form of knee joint replacement. And knee pain can be quite disabling. So how do you start to work out whether you need physiotherapy, whether you could consider keyhole surgery as a solution, or whether you should be thinking about knee joint replacement? And the first thing to say is if you've had a significant injury to the knee, particularly if you can't straighten the knee or your knee pain is getting worse, then go and get it checked out. Go see your doctor. However, if you've been having knee pain, which has been grumbling on for some time, then there's 2 main things to ask. How long have you had the pain? And what is the real nature of the pain? What does it feel like? Is it a sharp, catching, mechanical type pain? Sort of pain that grabs you with a sort of a, ooh. If it's that sort of sharp pain, then it may well be a cartilage or meniscal tear that's getting trapped in the joint and giving you a very sharp pain that may be amenable to keyhole surgery. So most of these symptoms will settle with a period of gentle physiotherapy, a short course of simple painkillers, keeping the knee moving. The cartilage tear should round off and symptoms slowly settle down over a short period of time. Exercise bike cycling through this sort of period, scaling up slowly, doing a minute per day in week 1, 2 minutes a day in week 2, until you're doing 20 minutes most days, is a good way to keep the knee moving and to keep the muscles around the knee nice and strong while your symptoms settle down. It's only if those symptoms have been going on for a few months, you can get a referral to a knee surgeon through your GP or GP practice. Keyhole surgery can then be used to tidy up any cartilage tears, but don't put yourself through that surgery if things are going to settle down on their own anyway. Keyhole surgery can flare things up, and there's risks involved to any surgery. If your knee pain is more tooth-achey in nature, without a strong catching or sharp element, then it may well be that you've got early, mild or moderate knee arthritis. The advice here is to optimize your body weight, keep the muscles around the knee nice and strong. Keyhole surgery is unlikely to help. And again, if your body weight is normal and your quadriceps strength is strong, so you're up to doing maybe 20 minutes of low impact cycling most days, and you've still got aching symptoms that get in the way of everyday life, then it may well be worth getting a referral in to see a knee surgeon. That's the time when you're thinking about whether knee joint replacement is the right route to go. So when thinking about joint pain severity, the questions are the same as with the hip. So generally, how far can you walk on the flat, numbers of painkillers that you're taking, and how your sleep is affected by the pain. Putting that together to see how your pain is interfering with everyday life. And a knee surgeon can then put that in context with an X-ray film of your knee to then discuss with you the risks and benefits of any joint replacement surgery. So when thinking about knee pain, if it's lasted more than 2 or 3 months, your body weight is in the right place, and you're doing the regular low impact cycling, maybe 20 to 30 minutes most days, then if you've still got significant catching pain, then keyhole surgery might be the route to go. If it's more of a tooth-achey type pain, then it may be that you're heading more towards joint replacement. Either way, the advice is to optimize your body weight, improve the strength in the muscles around the knee so that we keep the forces down and we keep the forces going through the knee joint well controlled. That helps to minimize inflammation, allows you to look after your knee joint so that your knee lasts you a lifetime. Thanks for watching.